What's up, beautiful people? Another day, another study. LP little a has been something I've been interested in a lot lately, and you're starting to see practitioners measure these things. I measure them in the new assessment for all my patients, or when I'm working in a new clinic. If someone's never had it measured, I measured it. And the reason for that is it is an independent risk factor for cardiovascular events, even in people who don't have any other cardiovascular markers. And we know that LP little a is mostly genetic, and about 90% of the level is genetic. And so things like diet and exercise, supplements don't affect it very much. And the current prescription medications we have don't affect it very much either. PCSK9 inhibitors are probably the best here, and they can reduce LP little a by 30 to 35%. But newer drugs that will be on the market soon can reduce it by up to 98%. So we know that in people who haven't had a heart attack or heart disease or stroke, that LP little a was a causal risk factor for the development of these ASCVD, atherosclerotic cardiovascular diseases. However, it was unknown if this was also a prognostic marker for a recurrent event. And so this study looked at over 270,000 people, and they followed them for a median of 5.4 years. And after adjusting for some covariates, a LP little a level less than 15 was kind of the cutoff for not increased risk. And then from 15 to 79, it was 6% increase, 80 to 179, 16%, 180 to 299, it was 26%, and then greater than 300, it was a 39% increase risk. So this is something we're going to see a lot more in the cardiovascular literature, especially as these new drugs come out. It probably will be standard of care to measure these levels, the LP little a levels, as a prognostic factor in people, and then to figure out who do we treat as far as primary prevention, preventing a heart attack, and secondary prevention. Those are the areas of data that I'm interested in following.